Viagra side effects. Mild side effects. Serious side effects. Side effect details. Allergic reaction. Priapism. Low blood pressure. Heart attack, irregular heartbeat, and stroke. Headaches. Side effects in older men. Erectile dysfunction, ED. Serious side effects from Viagra aren't common, but they can occur. Call your doctor right away if you have serious side effects. Call 911 if your symptoms feel life-threatening or if you think you're having a medical emergency. Serious side effects and their symptoms can include non-arteritis anterior ischemic optic neuropathy, NAION, which is an eye condition that causes damage to your optic nerve. Symptoms can include sudden decrease in vision in one or both of your eyes, sudden loss of vision in one or both of your eyes, sudden decrease or loss of hearing. This condition may also involve other symptoms, such as tinnitus, ringing or buzzing in your ears, dizziness. Other serious side effects, which are explained in more detail below in side effect details, include allergic reaction, priapism, long-lasting and sometimes painful erection, low blood pressure, if Viagra is taken with certain other medications, cardiovascular problems, such as heart attack, irregular heartbeat, or stroke, all of which occur mainly in people with heart disease, allergic reaction. As with most drugs, some people can have an allergic reaction after taking Viagra. In clinical studies, less than 2% of people who took Viagra had an allergic reaction. It's not known how often allergic reactions occurred in people who took a placebo, no active drug. Symptoms of a mild allergic reaction can include skin rash, itchiness, flushing, warmth and redness in your skin. A more severe allergic reaction is rare but possible. Symptoms of a severe allergic reaction can include swelling under your skin, typically in your eyelids, lips, hands, or feet. Swelling of your tongue, mouth, or throat. Trouble breathing. Call your doctor right away if you have a severe allergic reaction to Viagra. But call 911 if your symptoms feel life-threatening or if you think you're having a medical emergency. Priapism. Rarely, Viagra can cause priapism, which is a long-lasting and sometimes painful erection. But it's not known how often priapism occurs in men who take Viagra. Priapism is a medical emergency that needs to be treated right away. If it's not treated, the condition can damage the tissues in your penis and cause irreversible erectile dysfunction, ED. If you have an erection that lasts longer than 4 hours, go to the nearest emergency room or call 911. Low blood pressure. Viagra can temporarily lower your blood pressure after you take the drug. But this isn't a problem for most people. In clinical studies, less than 2% of people who took Viagra had low blood pressure after taking the drug. It's not known how often low blood pressure occurred in people who took a placebo, no active drug. But keep in mind that a sudden drop in your blood pressure could be dangerous if you have certain heart conditions. Sudden low blood pressure may also be dangerous if you're taking certain other medications. For example, you shouldn't take Viagra if you take nitrate medications to treat chest pain. You should also avoid taking Viagra if you take a drug called Riocigat, Adempas. Taking Viagra with these medications can cause a dangerous drop in your blood pressure that leads to heart attack or stroke. If you have low blood pressure, taking Viagra could make you feel dizzy or lightheaded, or cause you to faint. You're also more likely to have these problems if you take Viagra with certain drugs used to treat high blood pressure or enlarged prostate. If you feel dizzy or faint after taking Viagra, lie down until this feeling passes. If you have a heart problem or low blood pressure, talk with your doctor about whether Viagra is safe for you. For more information about taking Viagra with other medications, see the Viagra interactions section below. And for more information about taking Viagra if you have heart or blood pressure problems, see the Viagra precautions section below. Heart attack, irregular heartbeat, and stroke. On rare occasions, some people taking Viagra have had heart attack, stroke, or irregular heartbeat. These conditions mainly occurred in people who already had a heart problem. But sometimes these conditions occurred in people who didn't have a heart problem. It's not known for sure if Viagra caused the side effects. If you have chest pain after taking Viagra, you should stop having sexual activity right away. But call 911 if your symptoms feel life-threatening, or if you think you're having a medical emergency. And if you have a heart problem, talk with your doctor before starting Viagra. They can discuss with you whether it's safe for you to use this drug. For more information about taking Viagra if you have heart problems, see the Viagra precautions section below. Headaches. Headaches are a common side effect of Viagra. Headaches, as well as flushing and dizziness, occur because Viagra widens certain blood vessels in your body. The drug doesn't just affect the blood vessels in your penis. In clinical studies, headaches were reported in 16% to 28% of people who took Viagra. This percentage varied depending on the dose of Viagra used and how often the drug was taken. In comparison, headaches were reported in 4% to 7% of people who took a placebo, no active drug. If you have a headache after taking Viagra, it should go away fairly quickly. But if it's bothersome, you can take a pain reliever containing acetaminophen or ibuprofen. Ask your doctor or pharmacist to recommend a medication that's safe for you to use. If you have a severe headache or a headache that won't go away, call your doctor. They'll help determine the best treatment for your headache. Side effects in older men. Men ages 65 years and older tend to get higher levels of Viagra in their blood after taking a dose than younger men do. Having a higher level of the drug in your body could increase your risk of side effects. Because of this, older men are usually prescribed a dosage of Viagra that's lower than the dosage given to younger men. In clinical studies of Viagra, there weren't any differences in side effects seen in men ages 65 years and older compared with those in men younger than 65 years. If you have concerns about using Viagra given your age, talk with your doctor. Erectile dysfunction, ED. Taking Viagra doesn't cause new or worsening ED. However, Viagra can sometimes cause priapism, which is a long-lasting and sometimes painful erection. Priapism is a medical emergency that needs to be treated right away. If it's not treated, priapism can damage the tissues in your penis and cause irreversible ED. If you have an erection that lasts longer than 4 hours, you should immediately go to an emergency room or call 911.